tell me, are you the type of nurse that usually panics whenever you're going to work because you don't know what to expect in your nurse diary? Yes, you've done the right thing by clicking to watch this video, because we're going to be discussing the 6 common mistakes that nurses do make when completing the tasks in the diary. So I'll be back soon, and please do not forget to like, share and subscribe onto this channel, as this will improve the algorithm of this channel and this video, and will also motivate me to make more content for you to enjoy. Welcome back to my YouTube channel, and again, this is Nurse Mentorship Hub, where we discuss anything nursing, care assistant, healthcare management, healthcare leadership, and mentorship. So very quickly, the number one mistake that nurses do make is failing to check the diary before taking over a shift. So tell me, who does this? Many of us, we do that. Sometimes it's overconfidence. Sometimes we forget to do it. But this is actually a wrong thing to do, especially if you're working as an agency nurse or you're taking over from an agency nurse. So why is it important to check the nurse diary before taking over a shift? The number one reason is for you to understand the content of your diary and to understand what is expected of you. Sometimes things are written in the diary that are not well explained, or that will not be well explained to us during the course of handover. So it is very important to seek clarification where it's required. This saves you the embarrassment of having to call the nurse who you took over from when she's gone home. And again, some handwritings can be quite illegible, and it makes it difficult for you to understand what is written in the diary. So you need to make all these clarifications and be well confident that you can actually deal with what is in the diary before taking over the shift. And if you're taking over from an agency nurse who does not know the unit or the home very well, it is best you both discuss the content of what is in the diary and make clarifications. This is going to help you a whole lot. The second mistake that nurses do make when it comes to the nurse diary is failing to update the diary to reflect verbal reports that was handed over to them but were not documented in the diary. Sometimes the nurse handing over to us could have forgotten or could have been very busy and forgot to write in the diary for you to complete some certain tasks. Let's say, for instance, a resident had a form during her shift, just a shift before yours, and she had handed over to you verbally to contact the next of kin because she couldn't complete this because of the time of fall. So it is highly important you document in the diary, because at the end of the day, you may forget to make this call. And unfortunately, there are witnesses such as care assistants who saw this being handed over to you. And again, it is not a show of good professionalism if you can't complete the tasks that were handed over to you. And even if you can't complete those tasks, at least you are able to carry them forward. So you are aware of them and you're carrying them forward. So it's best you complete the diary to reflect any tasks that were verbally handed over to you, so as to save you the mistake of forgetting them. So the third mistake that nurses do make when it comes to the nurse diary is failing to prioritize their tasks very well. So I'm going to take for an instance, a resident had become unwell during the shift that was just before yours. So it was handed over to you to contact the GP to come visit this resident, or even just to seek advice. So let's discuss how we're going to treat this case. This would be my recommendation. So I'm going to be taking the obs of this resident first. It is possible that the nurse who is handing over to me had already taken these obs, but it's best I have my own obs that I can work with, just in case there are abnormalities and I need to lodge a complaint as soon as possible. So I have the obs down. The next thing I'm going to be doing is to contact the next of kin. I'm contacting the next of kin because I want to be sure of their preferences if I don't know this. Especially if you're an agency nurse, it is highly important to contact the next of kin if a resident becomes acutely unwell and be sure of their preferences. So you want to be sure if they want the resident to go to the hospital, if they want acute care at home team to come in and nurse the resident in the home. So you want to be sure of all this. And again, they can help you with some vital information that you may not be aware of, especially if you're an agency nurse. So I'm going to be contacting the next of kin. So let's assume I've done this. So thirdly, I'm going to be contacting the GP. So having known the preferences of the next of kin, I have my baseline data. I've contacted the GP. The GP had recommended or had prescribed the medication. So at this point, I'm going to check my diary and see if I have to follow up any medication at the pharmacy for other residents. So I'm going to be lodging the call for this resident, telling the pharmacy that I'm going to be expecting a medication, just to make them understand that I need it as soon as possible. And at the same time, I'm going to be following up all those medications for other residents. And lastly, I'm going to be contacting the social worker and let them know what has happened. Let's say this was done the other way around, contacting the social worker first, contacting the GP first. Before you know it, you become stressed. Let's say you contacted the GP before the next of kin, and the next of kin strongly says that this resident is not for hospital transfer. However, the GP had already arranged for an ambulance to take this resident to the hospital. But this GP does not know the preference of the next of kin because this has not been communicated to him. You are like the middleman. At the end of the day, you are going to be the one to be making the several calls. You end up getting stressed up and your time will get wasted. It's best you prioritize your tasks very, very well. So like I said, except in an exceptional case, my recommendation would be to take my observation first to serve as my baseline data, contact the next of kin to know their preferences, contact the GP and make them aware, follow up medication with the pharmacy, and contact the social worker. All right, so that's my hint for you. So another mistake that nurses do make is that they fail to do a task at the right time. So doing a task at the wrong time can actually make your day very, very stressful. I'm going to take, for instance, wound dressing. Doing a wound dressing before a shower is not a good thing to do. Like, you're just wasting your energy. So it's best to wait for the shower to be done first for so many reasons: infection control, tendency of the wound dressing getting soiled, different things could happen. And it is not good for you to neglect the resident just because you don't want to redo a task. It is not good for you to say a resident should not get showered just because you don't want a dressing that you've done to get soiled. That is not a good practice. So it is best to understand your diary very well and know the tasks for today. Ask the care assistant, who is for shower today? Know that so you can plan your dressing well. Another mistake is doing a dressing for a resident who is planned to be seen by a podiatrist or TVN on that day before they come in. This is not a wise thing to do. Podiatrist TVN will always like to know what is going on with a wound. They want to make their own assessment of the wound. They cannot depend on the information they've got from you, because why come all the way just for them to take a verbal report from you? So they need to see the wound, and definitely they need to make recommendations if required. So they need to see the wound. So it's best to allow them do the dressing. Just hold on unless the resident pulls the dressing away or it's overly soiled. So just wait for the TVN or podiatrist to do their job. Saves you energy, saves you time. All right. So another mistake that nurses do make is failing to update the diary to reflect the new tasks that have occurred during their shift. This is quite different from verbal reports that were handed over to you but were not in the diary. These are actually new tasks that happen during the course of your shift. These are actually tasks that don't go into progress notes most of the time. So it's best you update your diary to reflect it. So for your team, the group of people you're working with, not to feel that you're laziness, and for you not to be having to overly explain yourself. So once you have it documented in the diary and you tick it off, once they check it, they can actually see, oh, this was not handed over to me. Well, but it's written in the diary that she had completed it. So I'm going to take, for instance, a resident mattress is bleeping, right? And you've contacted Ajo, the supplying company. So they've promised to come in, but not on that day. However, it's bleeping, but it's not deflating. So it's still okay for the resident to use. So you're just monitoring it. And Because you've been busy, you failed to hand this over to the nurse taking over from you. And the nurse can find it anywhere that you've actually actioned this. So once you have it documented in the diary and you tick it off, once they check it, they can actually see, oh, this was not handed over to me. Well, but it's written in the diary that she had completed it. So let's say you're going to go on annual leave. At least the nurses taking over from you will understand that, oh, the next day we're going to be expecting a mattress from Ajo. So this is a nice thing to do. I learned it from a colleague, and this has been very, very helpful. It has helped me. It has helped the colleagues working with me. So it saves us the stress of having to make multiple calls. Because if the nurse does not have that information, she'll have to call Ajo, right? All right, so don't forget to update the diary to reflect new tasks that you've actually taken care of, or new tasks that you've seen. Even if you were not able to take care of it, you've carried it forward. So don't forget to update the diary to reflect this. And lastly, another mistake that nurses do make, which is not nice, I can tell you, is failing to update the diary to reflect tasks that needs to be carried forward. I'm going to take, for instance, a resident catheter has been reinserted today. It's next due in the next 12 weeks, but this was not documented in the diary. This is not a nice thing to do. You're putting yourself at risk, and you're also putting the colleagues working with you at risk. You're also putting the patient especially at risk, because this man is at risk of sepsis. So always make sure that you document that task as soon as possible, especially wound dressing. Sometimes nurses fail to document the diary to reflect when it is next due. It is not nice. This resident could have infection because of this negligence. So don't forget to always do this. So in the course of this video, we've been able to discuss 6 common mistakes that nurses do make whenever they are completing the tasks in the diary. So number 1 being that failing to check the diary to understand the tasks that is there before taking over a shift. Number 2 is failing to update the diary to reflect verbal reports that were given to you during handover but were not written in the shift. Number 3 is failing to prioritize your tasks very well. And number 4 is that failing to complete a task at the right time or doing a task at the wrong time. Number 5 is failing to complete the diary to reflect new tasks that occurred during the course of your own shift. And number 6, which is the last one, is failing to carry forward a task for when it is next due. So I hope you've learned one thing or the other from the 6 mistakes that I've mentioned and explained. And thank you for watching this video. Thank you for taking your time. This is my very first YouTube video, and thank you for liking, and I'm sure you're going to share it. And I want to be sure you subscribe. I want to please urge you to drop in the comment section some other common mistakes that you think nurses do make during the course of their shifts. If you also have some additions, some suggestions, and if you have idea, share your idea about nurse diary, please do that. Likewise, if you would like to make clarifications on things that are not even related to the nurse diary, if you want me to make video content on it, please drop your ideas in the comment section. I would really appreciate it. And please, if you've subscribed onto this channel, please do not forget to let me know in the comment section so I can give you a special hug, and I'll definitely see you in my next video.